Hi, I'm Cindy Novak, Downsize Administrator with the Carolyn Stark Real Estate Team. Thank you so much for joining us for our Home Edition event. Today we've got a great program to share with you. We've got Sue Coyle of Coyle Care Management and Consulting, and she's going to be presenting Dementia 101. She'll contrast dementia and Alzheimer's, and she has some advice for family caregivers. She has over 30 years of experience working with older adults, and she brings knowledge of resources in the community to improve quality of life for seniors and their caregivers. Now, here's Sue.
Good morning, everybody, or good afternoon, or whatever time you happen to be tuning in here. Thanks for joining us here at Keller Williams Fox Cities. My name is Sue Coyle, and my presentation today is called Dementia 101. I've learned over the years that I think there's a lot of facts and fallacies about dementia, so that's really what we're going to talk about today. As I said, my name is Sue Coyle. I'm an aging life care manager, and my business is Coyle Care Management and Consulting. So I work with older adults and very often their families to help coordinate, manage, or help determine, I should say very often, and then coordinate and manage their care needs. So a whole different realm of services included in that. So once again, who am I and what do I do? My background is as a certified occupational therapy assistant with 30 plus years experience. So with that, I really was trained to look at how people are functioning and helping them to function at their maximum independence and functional level. And that's a lot of what I still incorporate into my work, and even with people who I've worked with over the years who have dementia. I have a bachelor's degree in healthcare management that I got just almost 10 years ago. I have an extensive background in working with people with dementia. I've been a dementia care specialist since 2000, which is when they first came out with training and certification as such. And with that, I had managed a 38-person memory care program within a skilled nursing facility, and prior to that, an 18-person community-based residential facility, so what is commonly known as a CBRF. For the last, I think, 2 years now, I've been a Purple Angel dementia awareness trainer, which I love doing. For those of you who don't know, Purple Angel training is a program that we do mainly to businesses to help make the Fox Valleys a dementia-friendly community and environment. And of course, as I said, I'm an aging life care manager, and I've been nationally certified as one since 2006. And I'm actually the only certified aging life care manager in the Fox Valley. I've owned my own business since 2011, and more than anything, I've had personal experience with both of my parents who had dementia when they passed away. And as well, my client base is many people with Alzheimer's and or dementia, as well as many other physical conditions. So, what are we going to talk about today? Obviously, the basics, what dementia is, what Alzheimer's is and is not. And we're going to talk about recognizing some of the signs of dementia, the diagnosis process, general communication with people affected with dementia. And I will tell you that's one of the favorite things I love to teach and help people to understand and deal with, because it's so important. And then what help and or support is available. So I'm going to give a disclaimer. As I said, I love doing the Purple Angel training, so much of my information is taken from that Purple Angel Dementia Awareness Training Program, and that program is a program of the Fox Valley Memory Project. So let's get to the nitty-gritty. This slide shows an umbrella, and dementia there is at the top. So many people have the misconceived notion that Alzheimer's is like the worst kind of dementia, or it's dementia, now it's turned to Alzheimer's. That is really a fallacy. as you can see, dementia is an umbrella term that describes a collection of symptoms that are caused by disorders affecting the brain. Dementia alone is not one specific disease. It affects thinking, behavior, and the ability to perform everyday tasks. And brain function is affected enough to interfere with that person's normal social or working life. The most common type of dementia is Alzheimer's disease. So that's an umbrella term, dementia. It's an overarching term, and Alzheimer's disease is just one of those. I like to compare it to cancer. You know, that's a big, ugly word, and there's many, many different kinds of cancer. So dementia is obviously very similar. Alzheimer's disease is the most common type of dementia and accounts for about 40 to 70% of all dementias. And then there's vascular disease. That's the second most common type of dementia, accounting for about 15 to 25% of all dementias. Vascular dementia is often caused by what is sometimes referred to as mini strokes, or it's really where, you know, parts of the brain just aren't getting the blood flow that they should be. Lewy body dementia is another type. It accounts for 2 to 20% of all dementias. Frontotemporal, where it affects this frontotemporal part of our brain, and that's approximately 2 to 4%. And then there's many other dementias, as you can see here. They include dementias associated with Parkinson's disease, Huntington's disease, head trauma, HIV, alcohol. Alcohol dementia is not pretty to deal with. People who have alcohol-related dementia have a lot of psychoses with that, more of the psychiatric challenges. Creutzfeldt-Jakob disease, sometimes in the past had been referred to as mad cow disease. Corticobasal degeneration, which is really where the brain is just degenerating, and also progressive supranuclear palsy. So this is just a handful of the many types of dementia that fall under that umbrella of dementia. So dementia in and of itself is not a specific disease. Like I said with the umbrella, it's an overarching term that describes a group of symptoms associated with that decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. And we'll obviously get into a lot more of that as we go. It is a progressive impairment in memory, language, judgment, and abstract thinking. Obviously, progressive means it's not going to get better. It's only going to progress and get worse. All Alzheimer's is dementia, but not all dementia is Alzheimer's. You know, that might sound a little confusing, but like I said, dementia is really an umbrella term. For the purpose of our discussion today, I will be using dementia as that all-encompassing general term. Actually, and the one thing I want to go back to here, as far as Alzheimer's, I want to say what Alzheimer's is not, and it is not Alzheimer's. Commonly, I hear that term used, and many people, you know, associate it with old-timers, which to me is kind of a derogatory term, but it's just very often mispronounced and or misperceived. But it is Alzheimer's, and it was named after, I believe his name was Alois Alzheimer's, who had first identified the brain changes. And I should know the year, but I don't remember exactly. So it is Alzheimer's disease. Okay. So then let's look at normal or dementia. So some common age-related changes. So we're going to look at what's normal. You know, we all make bad decisions occasionally. You know, maybe say something and later we think, oh my God, I probably shouldn't have said it that way. Whereas a sign of dementia is just really poor judgment. You know, very often doesn't realize that that was not an appropriate thing to say or do. Missing a monthly payment. versus an inability to manage a budget. So we'll get to that a little bit more as we go on too, but financial mismanagement is very often, I tell the families I work with, one of the earliest signs of dementia, but unfortunately it's often one of the last to be seen, especially with the older adults. Many of them grew up being very private and protective of their finances. So very often the kids or even the spouse doesn't have access to that information until there's a crisis. I recently had a couple that the husband had dementia, and he basically had spent away all of their IRAs, and I think they had some money market funds, and the wife had no idea of it, and the husband had no idea where it went. So, the money management is very significant. Forgetting which day it is and remembering it later. In this day and age, how many of us forget? I have to look at my watch or look down here, at my computer. Oh yeah, today's the 24th of June. So I think in this day and age of electronics, that's become easier to do. Many people don't use calendars anymore. I get totally annoyed when I'm at my kids' houses because they don't even have clocks. So sometimes it's easy to forget what day it is and even know the time of day. So here again, signs of dementia is losing track of the date or season. Sometimes, when they think it's, fall, and here we are in the thick of summer. Sometimes forgetting which word to use. We all have that, where we just can't think of the word that we want to say. Versus a sign of dementia is having difficulty even following a conversation. Or very often they'll withdraw from the conversation because it is too hard to process everything as it's going on, and then maybe too hard to find the words they want to say. And then losing things from time to time, misplacing. And how many of us don't do that? I put things away and go, okay, it's got to be here or here or here. Versus, people with dementia, they're unable to retrace their steps to find them. I did that just the other day. It's like, okay, I had some super glue and it's either in this drawer or this cupboard or it's in my office. So yeah, kind of had to retrace my steps and kind of my reasoning. Oh yeah, that's right. I put all the glues together in this drawer. So, here again, I was able to recall that and know that, whereas somebody who's in those even just early stages of dementia very likely may not be able to do that. So dementia is not. Many people say, oh, it's just a normal sign of aging. Even doctors say that. Many people can live to 100, 105 and have no trace of dementia as they age. However, the chances for getting some type of dementia increase as they age. The brain naturally loses neurons as it ages, just like our body mass maybe degenerates a little bit and a lot of other physical changes. There are physical changes that happen in the brain as we age, and that really is that deterioration of neurons. And that can cause slight memory losses without it necessarily being dementia. Okay? So we're going to get into the signs of dementia. If you Google it, like the Alzheimer's Association, many websites, much information, lists 10, that there's 10 basic signs of dementia. I have, I think, close to 20, that I really compiled from a lot of different sources, but also based on my experience as well. So the first, obviously, is change in memory or function that disrupts daily life. Difficulty following or participating in a conversation. We already talked about that. Confusion to time or place. They may think that they're at church and they're at the grocery store, or where they were going. May misperceive visual and spatial relationships And they might see things that aren't real. That very often what we call hallucinating, and that is most often associated with a particular type of dementia. And a lot of times families or loved ones just discount it that, I don't know, Dad could have sworn he saw, a little person over in the corner of the room. To Dad, that's real. Obviously, we know it's not. May forget or substitute one word for another. For instance, that long yellow thing when they're trying to ask for a banana. Okay. Misplacing or hiding things and forget where they are. I kind of just used that example of looking for my super glue, that I really had to kind of retrace my steps and my logic as to where I had put my super glue. Impaired judgment and or reasoning may become more argumentative and or accusatory. I dealt with this a lot with my own mother. and it's hard to be the bad guy, but she just became very accusatory and angry as her dementia started and progressed. Withdrawal from work or social connections. Once again, they really cut off a lot of those social connections. They may just forget about them, or as I already said, it just gets difficult to follow a conversation, to process what they want to say, and just to kind of take it all in. And with that, like I said, they withdraw from work or social connections and they become more isolated. And then that isolation leads to further decline because they're just not getting the mental and social stimulation that is so good for most of us. With that, my heart breaks every day for all of the people in nursing homes and assisted livings and, even just apartment buildings who are so isolated through all this COVID. And obviously, I certainly understand the reasons for it, but I've talked to many people in the group homes, the people who work there, and they're seeing significant declines in people who otherwise didn't have significant dementia. And it saddens me because these people, it saddens me what the social isolation is doing to them. And like I said, obviously I understand the reasons to protect them and their environments against COVID, but mentally and socially and even physically, my heart just breaks every day for a lot of those folks. So I keep hoping and praying that some of our restrictions are loosened up a little bit for those folks in facilities. So more signs again. A lot of people say, oh, Mom can remember. She just told me a story the other day about, when she was in high school. Yeah, she can. Typically with dementia, loss of short-term memory is more prevalent, but the long-term memory often remains intact, very often until even late-stage dementia, that they may even regress to when they were a child. But that long-term memory, I always like to compare it to a file cabinet. We have a file cabinet, we tuck all of our information away there in that file cabinet, and we have it, it's all stored. But our short-term memory maybe is in a file sitting on the desk. So it's really not registering quite as much. We already talked a little bit about difficulty managing money, forgetting to pay bills, or I had one client where they were paying bills multiple times. The checkbook is a huge thing. I know even with my own parents, my dad had always managed the money, and it was at least a year when we finally started helping him and them, and some of the checks he had written were just really bizarre. So their financial situation was actually way worse than we had even thought. And like I said, unfortunately, it's often not found until it's too late. And then, with that, there's poor decision making, and thus they're more vulnerable to getting scammed. Those phone callers and seeing something on TV and, sending the check. So, and then even when they're shopping, difficulty finding the correct cash or change to pay for items. A lot of older folks still don't use debit cards. So, they're going to use cash, but I've seen, where they just give their wallet to the checkout clerk and say, hey, here, you find it, which can be dangerous. And we just always hope and pray that there's honest checkout clerks. And that's been a big part of the Purple Angel training as well, is training people in retail and all different businesses. Here at Keller Williams, they've done the Purple Angel training. So, but really how to deal with that. So repetition, of things that they've already asked and said. And for many people, especially family members, it's probably one of the most annoying things. Mom, you already asked me that, and I already told you the answer 5 times. You just go with that and just answer it again or try to change the subject. Apathy, they no longer care about previous activities or hobbies. My mom used to do a lot of word searches and crossword puzzles, and she was an ace at it. And over the years, it just got too much for her brain to handle. I'm kind of skipping around here. Getting lost more, even in familiar areas. I had a client one time who, from his lazy boy chair, you could actually see the bathroom and the toilet. It was probably 15 feet, but he would get lost in his own house, and that was just so heartbreaking. Difficulty adapting to new environments, and as well as routine people and places, and a lack of focus or attention. So we get to what do we do if we suspect dementia in a loved one, ourselves, a spouse, a friend. So recommending and starting with a general exam with the primary care physician is usually the best way to go, so that they can rule out potential causes. There are physical causes that can cause symptoms of dementia, such as vitamin B12 deficiencies, thyroid changes going on, depression, and several others as well. So, that general physician should always start with blood work, with lab work to, really make sure that all of the body's functions are normal. They might also order some brain imaging, a CT scan. Most often an MRI is more ideal because it shows the changes in the brain more so than a CT does. But a lot of primary physicians don't order MRIs right off the start because it's the more expensive option. I very often recommend a neurologist or neuropsychologist, as well as many primary care physicians do now, to do that extensive memory exam, memory evaluation, and other cognitive testing. And then very often they can recommend medications or prescribe medications, but it's important to know that they can only slow the progression. The medications are not meant to cure any of the dementia, and it also depends on the type or types of dementia. I had a client years ago when I worked in the memory care who had been on Aricept, which is back then was the most commonly used dementia medication, and her family wanted to take her off of it because she was already in memory care, and it was expensive and she was running out of money. We tried our best to talk the family out of it, but we had to honor their wishes. 2 weeks after that, the nursing assistants came to me and she said, "What is wrong with this lady? She used to wash and dress herself, and now she doesn't even know what to do with her clothes." And that was devastating because here again, it's not just the memory that's important, but it's the function. It's being able to continue to get herself washed and dressed, but and she was even picking out her own clothes. And all of a sudden they were laying them out on her bed and she still didn't even know what to do. So with the Alzheimer's medications, we may not think we see improvement or stabilization, but unfortunately you don't know until you take them off of it, and then it's most often too late to regain that. So medication is tricky, and here again, it varies, depending on the type of dementia, depending on the doctors, depending on the behaviors. So there's a lot of variables. Some people choose not to use medications. Personally, with my own parents, I didn't bother having either of them evaluated because my dad wouldn't take the medications he was supposed to be taking, so there was no way I was going to potentially try to add another one. He would have told me right where to go. So ways to adapt on that. Simplify their environment and their routines and their conversations. You know, if their environment is real cluttered, try to unclutter it as much as they will allow. I know that's always a challenge too. Write things down. You know, if you're coming to pick mom up for a doctor appointment next week, write it down so she has that visual reminder about it. Be patient and talk slowly. I am guilty that sometimes I have to check myself and slow my speech down, when I'm talking to folks with dementia. Avoid saying, "Don't you remember we talked about that?" Instead, use I statements like, "I remember last time I was here, I put your checkbook in this drawer right here. Do you know where it might be now?" Instead of, "Mom, you moved your checkbook again. Where the heck is it?" So, we don't want to be accusatory. So I always, try to state it as an I statement. Using simple language and yes, no questions, obviously avoiding the open-ended questions. Be precise. Avoid pronouns such as he, she, they. Let them know who you're talking about. Avoid sayings such as, "Let's get going now." I may be saying, "Let's get going now" to my mom to prompt her to start, bathing and dressing, and she may look at me and say, "Where are we going?" So just really being aware of those general, colloquial, I think it is, phrases, and saying specifically what you mean. "Mom, it's time to get dressed now. Let's get started on that." So, and then minimizing extraneous stimuli. Very often folks are hard of hearing and they have the TV blaring. Once again, I approach that as an I statement. Instead of asking, "Can I turn your TV down?" I will say, "I really want to be able to hear what you're saying. Do you mind if I turn your TV down so that's easier to do?" So I'm making it my problem and not theirs. So just minimizing that extraneous stimulation, noise, and other activity. More ways to adapt. I just addressed using I statements versus you. Remind them who you are, almost like an introduction. In my mom's later days, when I would go to see her at the nursing home, I would just say, "Hi, Mom, it's Susie." One day she looked at me and she said, "No kidding." And as her dementia progressed, she said, "Oh, yeah, that's right." So I would always say that no matter what. Use eye contact and nonverbal communication as much as possible. Here again, and we'll get to that a little bit, I think, on the next slide, that, they may not understand what we're telling them, but they understand our body language and our emotion and our facial expressions. Focus on what the person can do versus what they can't do. Maybe Mom can't wash dishes anymore, but, here again, doing it as an I statement. "You know what, Mom, I'm going to wash dishes, but how about if you come and help me dry?" That might be easier for Mom to do and less threatening. Don't exclude or talk over or above them. This happens a lot in public. That maybe, you have Mom at the restaurant and, she will have this, this, and this. Let Mom talk for herself. I also try to narrow the options. I had a client one time and we were at lunch and I said, "I remember last time we were here, you really liked this chicken dish or this salad. Do you think you want one of those today?" And by doing that, it helped her to narrow down all those overwhelming options on the menu. And then when the waitress came, she was able to order it herself. Whereas a lot of times family will just say, "She'll have this, this, and this." So, and if you have to repeat calmly, which can be hard sometimes. We can lose our patience. So once again, be aware of body language and facial expressions, and be aware of their body language as well. If you see them kind of starting to, cross their arms and frown, they're getting frustrated or they're not happy with you. On the other hand, if you're standing there talking to them and you're standing there with your arms crossed, it may look like you're just getting frustrated and indignant. So just being aware of your own body language, your tone of voice, and also how they're responding. So others can sense your emotions and tone of voice. Respect their personal space, and more than anything, smile. I've learned that when people are confused or becoming agitated, sometimes just a smile and just say, I'm sorry you're feeling this way. And a smile can just go a million miles. So the phrase I have here, people may not remember what you said, but they will remember how you made them feel. And this is a quote from Maya Angelou, and I use it a lot because it's very true. Very often when I see my care management clients, and very often the family or the caregiver spouse will say, oh, I feel so much better after we've talked. I just feel more hopeful and more at peace. To me, that's the ultimate gratification of doing what I do, because not necessarily that I was there to help them, but how they feel when I'm leaving. So when we talk about communication, this is one of my favorite things. So it's a little comic. 3 ladies walking down the street. The one lady says, it's windy today. And the next one says, no, it's not, it's Thursday. And the next lady says, so am I, let's go have a beer. So, it's that lack of hearing and, how each of them perceives what was said. So with that, I like to share the story of last year when my mom was in the hospital, and my sister had finally gotten there, and she said, hi, Mom, I'm finally here. And my mom looked at her with what we call the mom frown. It's this hideous, contemptuous frown, and said, what do you mean you're trying to hear? Are you deaf? And I literally was on the other side of the room, and I had to walk out because I was splitting a gut trying not to laugh. So, it's real. On the other hand, my sister was at the door when she said that. When she walked closer to Mom, Mom got what she was saying. So, oh my gosh, that was just one of my funniest moments. So my sister and I have laughed about that quite often. And the whole point is find and appreciate the humor. And in that, it was the irony. What do you mean, are you deaf? When in essence, my mother was quite hard of hearing. So just one of my favorite stories, and the point is to take into account that overall communication. I also often share a story that same time when my mom was in the hospital, she had been feeling nauseous after supper. And I was sleeping in the room there with her, and it was about 2 a.m., 2 in the middle of the night. And this little new, fresh, cute little nursing assistant comes in, bends down and whispers by my mom's ear, are you nauseous, hon? And I kind of woke up and I thought, what did she just say? And she said it again, are you nauseous, hon? She never said my mom's name, never even touched her, to try to wake her or get her attention. I sat up and had to just do everything to control my anger and my frustration. I said, excuse me, her name is Anna and she's hard of hearing. And everything about that was just so wrong. My mom didn't even remember she'd had been nauseous 7 hours before that, which was really stupid. So once again, it's that communication. I did talk to the hospital person in charge about that as well, because it's just that basic communication that professional caregiving staff should know. And it's just, a lot of it is my own personal pet peeves because I've done this as long as I have. So what help is available? Obviously, my own shameless plug, an aging life care manager. In my role as that, I really help the loved one, very often the caregiver, the primary caregiver, whether it be that adult child or spouse, to assist and navigate the processes. So very often, I may get the call saying, we need help and we don't know where to start. So that's where, I'll chat with them over the phone and then potentially meet with them. For me, especially because of my occupational therapy background, which is all about function, that home visit is so valuable because I can see if, it's a hoarding environment or if it's a cluttered, unsafe environment. I always check the basic safety things to make sure there's no loose throw rugs and, that the loved one can get in and out of bed and on and off the toilet. So I'm doing that physical assessment, but it also helps me to know their daily living and functioning level as well. So, that's where I just kind of, get to the nitty gritty. By knowing how they're living their daily life, that can give me a great idea as to, what their needs are. And then also just really talking to that primary caregiver. Most often, even though that person living with dementia or physical impairments or both is technically my client, but I always say the caregiver is really my client because my role is to help keep the caregiver healthy so they can continue to be the caregiver. So, just offering that caregiver assistance and support. The county aging and disability resource centers, I'm sure most of you have heard the term ADRCs. They have a wealth of resources. They have now, I think all 3 local counties now have a dementia care specialist. So, and that person is somebody who really works directly with families to do the training and kind of I can't call it counseling, but just really kind of helping them through some of those processes. The ADRCs also do the intake and assessments. They can't make specific recommendations, but they can make general recommendations. Perhaps you could call some non-medical home care to relieve yourself, a couple of days a week. And then they also have benefits specialists who just have a wealth of resources, or knowledge, I should say, about all of the benefits such as, Medicaid, Social Security, different county programs, veterans programs that may be able to offer some financial assistance. Having a memory assessment. Mosaic Family Health has their memory assessment program, and the Neuroscience Clinic also does it. There are some independent providers, mostly neuropsychologists or even psychologists, who also do a pretty in-depth cognitive assessment. And that can be very helpful because they don't just look at memory, but they look at the processing and reasoning and judgment, and even visual perceptual, because all of those things can be affected. And then the RCI, which I believe stands for Rosalind Carter Institute, and it's the REACH, and I know that's an acronym as well, but what it is escaping me right now. In-home caregiver program. And I very often work very closely, that is through the Mosaic Family Health Clinic. I very often work closely with Heather Flick, who is the coordinator of that program. If I have clients that are just really struggling, especially that in-home caregiver, and she then works with them, it's actually a standardized learning program, but I believe she really tailors it to that family's individual needs, really in teaching them how to cope and adapt and react to the challenges of dealing with being a caregiver, and most often with somebody with dementia. The Alzheimer's Association is also a wonderful resource. They do have a 24-hour helpline, for people who are just really struggling and, need some support and direction. And there's others out there. These are just really some of the main services. So then next is what support is available. There's many support groups in our area, obviously Mosaic Family Health, St. Paul Elder Services, who has a very robust memory care program, but they also have their memory care resource center. They do several different types, kind of stages of support groups. I know they have an early stage dementia support group, and so they just have a lot of specifically geared. I believe Ascension still has a caregiver support group. And I know there's a couple out there. There's a program called Family Caregivers Rock, and they do a support group, but are also just kind of a fun social support as well. And then we have the memory cafes. Those have grown to be so popular here in the Fox Valley area and are a part of the Fox Valley Memory Project. And they're really fun social meetings, outings, and activities. But the whole purpose is meant to, number one, make our community a dementia-friendly and dementia-aware community. That's the whole purpose of the Purple Angel training as well. And also just to provide that fun outlet. So often, that, and I'm going to use the example of a husband and wife who, one of them has dementia. They run out of things to do to socialize. Maybe their friends no longer call them to go out to dinner, or dad is just no longer able to handle all of that stimulation and conversation in social settings. But the memory cafes are meant to provide that setting. And I know it's often been said that many times you can't tell the person with dementia apart from the caregivers. And that's really what they strive for, that everybody is treated equally and on the same levels. With that, there's also what we used to call caregiver cafes, but they were getting mixed up with memory cafes, so we changed the name to caregiver chats. They're based on what's called a World Cafe, which is a bigger program, I guess. And what it is, it's structured conversation alternative to support groups. And I am a founding member of our Allegheny Caregiver Coalition, which was started over 10 years ago. And our mission and vision is really to provide education and support to family caregivers and the community. So our caregiver chats are structured, that we have planned questions to foster the communication among the participants. If it's a big group, we'll have them separated out into maybe 2 or 3 tables. Obviously, it's been done virtually now. They just had their first one last month, and I believe the next one is coming up this week or next. There's always a topic, and so obviously doing it virtually, we've been able to open it up. I had sent the information to a bunch of my clients and family caregivers, and one of my family caregivers lives in Green Bay, and she works until 4 o'clock. They had the virtual caregiver chat at 4 o'clock, so she was able to hop on and really enjoyed it. So, but otherwise she would never come, obviously would never drive to Appleton for it. So we are opening it up, I believe, statewide now, or if there's a caregiver in Timbuktu who wants to join in via Zoom, they can. So just kind of a fun alternative. Last month their theme was on food, I think, because it's over the supper time, what to eat. And then for support also, there's respite services, which, the counties have some programs that provide funding for that. If the loved one or the person affected is a veteran, there are some veterans benefits that will pay for some of that, as well as just non-medical in-home care. So sometimes the VA will pay for some of that non-medical in-home care, which is their way of providing respite. But there are some funding sources out there. The challenge is knowing about them and finding them. Okay, so respite services can come in many different forms. There are some facilities, assisted living homes, that will admit people on a short-term basis if that family caregiver is going away on vacation or simply needs a break. Very often when I first see clients, the person with dementia or the person that's impaired may be doing just fine, but the primary caregiver is this far from a breakdown. So it's getting those pieces in order for respite care for that primary caregiver that's so important. Lyrics and Laughter is a program, I believe it's still going, but here again, I'm not sure how they're doing it amidst COVID. And it's done through the Valley VNA in Neenah. So it's really all about singing and laughing and having fun. And I know Valley VNA in general has a very strong focus on music, you know, to incorporate into their residents' lives and people with dementia. So once again, this is just, you know, kind of a very general. There's many other forms of support out there, even just those phone call check-ins or even just a card, you know, to those people who are caregivers or those people affected, or just even, you know, elder friends who are living independently in their own home or who are in an assisted living. Any of that is so supportive. When all of the COVID quarantine first started, I was making it a habit whenever I had time to call a lot of my current, but even past clients. One in particular who was previously very social, and she told me her family did a Zoom call, and her extended family, and they're all out of state. And she said it was so fun, but I couldn't get my camera to work, so I didn't really feel like I was a part of the party. So, you know, I have right on my laptop, you know, a couple different written instructions on how to use Zoom. She's tech savvy, so I just emailed that to her so she could be a part of the party next time. I've also walked a couple of my clients through the simple basics of how to do a Zoom call, but even just to do a video call. I was on a call one day with one of my clients, and I said, and she always says, we're not technological, her and her husband, and they're fairly young. And so I said, okay, you have a Samsung phone, right? And she said, I don't know. And she asked her husband. He said, yeah, they're both Samsungs. And I said, okay, so do I. So I want you to do something. I want you to take the phone away from your ear, press the speaker. She's like, I think I can handle that. Okay, got it. I said, now I want you to press that little video camera in the top row right in the middle. And so she did that, and I said, I can see you. Can you see me? And her response, I can't say here on the air, but it was pretty fun and funny. So, you know, once again, it was just taking those couple of minutes to show her, to walk her through how to do that. And unfortunately, she's now in assisted living, and I keep trying to prompt her and her husband to do those video calls. And so I even said, I will send you the written instructions if it's helpful. You know, so sometimes just taking that little bit of time to walk our seniors, our older adults, our caregivers through that little bit of technology that right now is a lifeline for so many of us and for so many of them. So even I myself, you know, have a lot of different Zoom meetings, and more of my meetings are starting to be in person, I mean, but it's very optional. But I just miss being with people. Yeah. So even a Zoom meeting, I have one group where we make it mandatory that everybody has to have their camera on, you know, because otherwise we know we're all multitasking in the background, or maybe we just crawled out of bed. But, you know, it's our meeting, and let's all be there with each other in person. So, you know, it's just so important to have that personal contact, which is very supportive of what our older adults and our caregivers are going through. And even those, especially those with dementia, who are just having such a hard time even understanding all of this COVID stuff. So, normally I would open this up to questions, and I'm sorry we don't have the ability to do that right now, but I thank you very much for taking the time to tune in, and I hope it's been beneficial for all of you. If you ever have any questions, my contact information is here. Again, the name of my business is Coyle Care Management and Consulting. My website is the same, coylecaremanagement.com, as is my email, sue@coylecaremanagement.com. And obviously my phone number is here as well. So I welcome any calls or emails at any time if you're just struggling and just need to say, hey, I'm not quite sure what to do with this. You know, I most often with most of my clients do the kind of the free initial consultation over the phone. So, and if I can't help you, I never just leave you hanging, but I always try to offer some other options. So that's all for now. I thank you all very much for listening in today.
Thank you, Sue, for that wonderful presentation. I am Carolyn Stark with the Carolyn Stark Real Estate team here at Keller Williams. We are happy to bring you this home edition. We hope you are all staying safe, and we look forward to seeing you all in person in the future.